Hi everyone, I am Dr. Sudakshina and I am Professor and Training Center Chief of Chettinad Simulation and Skill Center, and we are just concluding Advanced Cardiac Life Support Provider course, obviously American Heart Association accredited at our International Training Center. And with me I have one of our first year PGs and Community Medicine PG, Dr. Priyanka. Yes, and she is one of the first person to take up this course from her batch. And what did you feel, Priyanka? You had a basic life support and then you had 2 days of advanced cardiac life support. How did you feel the course was?
As a community medicine PG, the BLS course was really useful to us. When we face such a situation in a community, we know the basic supports that we can give them immediately instead of waiting for an ambulance, and we can alert them immediately to call the ambulance and the steps followed in managing airway and so.
Yes, and on top of that I think you learned how to give a compression.
Yeah, right? We learned to give a high quality CPR,
because that is the main thing in a rescue situation. As we told, 80% of the rescue is because of a high quality CPR, and only 10% is going, the credit goes to the advanced cardiac life support, right? The pharmacological agents and all that. So it's very important that you give a proper BLS in the peripheries.
Yes,
and then yes, definitely the team will come, but even when the team comes, the paramedic team comes, the team dynamics becomes so important, and they come with these pharmacological agents and all that. So that's why over there you are using again the advanced cardiac life support. So that is why it is very important that any field, a doctor should know a basic and an advanced cardiac life support, and do not panic in this kind of situations. And it's not only for doctors, you know that these are for all healthcare professionals. We are targeting all the healthcare professionals in our institution and outside. Right? Yes. So how were the scenarios and all that? What did you feel?
We were given real life scenarios. We saw videos where they did it out, and then we were also told to enact it out, and we were able to learn through it following the algorithms that were given to us.
And there were like these instructors who were teaching you. Actually they have been there in this AHM member, and they have been continuously teaching over so many years. So they know how to make it very simple.
They gave us inputs where we lagged and where to correct our mistakes.
And it was very simplified.
Yes.
And there were some protocols which were told to you that you should go over and over again to remember.
Fixed protocols
and
were
I
there.
think you won't even forget those things, right? Some of the things you won't even
Definitely,
forget, because you will keep on remembering it. Right? Yes. So what about your mega code? You became a team leader, right?
Yes, ma'am.
Yeah. How did you feel as a team leader? Have you got any leadership roles till now in your whatever career you have, right? You are a doctor. Were you a leader ever?
Roles were there, but none was this much pressure as this one that we had today.
Not pressure, I think lot of responsibilities. Because with the leadership you get lot of responsibilities, and you start accepting those responsibilities and you work out as a leader.
Yes, ma'am.
Right? So this is not only a course where you learn the life support measures, but also some personality development also happens. Don't you agree that?
How to work as a team and coordinate everybody, manage the things.
Yes. And as a leader, what is the case you got?
I got trauma case, ma'am.
Very good. So you went about with the trauma. There was blood loss, there was hypotension, there was tachycardia, right, for the patient.
Yes.
And then what did you do for the patient?
Immediate management according to the algorithm. We followed it.
You went the tachycardia algorithm, and the patient went into arrest?
Yes, ma'am. So we did again according to the cardiac arrest algorithm.
Very good.
And then once return of spontaneous circulation was there, we followed that algorithm.
Very good. So you are talking like an ACLS expert, right? So congratulations, you did very well. I'm very happy and looking forward to make you an instructor, because you are very good in expressing your views. Yeah, thank you all.
Thank you, ma'am.